Hey everybody, it is Matt and Dyan. Welcome back to OK Aussie. It is Tuesday. What day is it? Tuesday the 15th of April, and it's 11:11. We have another situation going on. Time for something different. I've just given Dyan a Valium 5 milligrams, also some CBD THC 1010 0.5 mils. She is having dystonia both in the hands and facial, or mandibular and blepharism. Bear with me, boo-boo. Do we get a night? Do we get a day without any of this? It's frustrating as fuck. It really is. And please, I'm going to put some tape on your hand. Good girl. Fingers moving, fingers moving. Moving target, moving target. Okay, I'm going to tape you. Some data, I need to see where you're at. Are you getting chest pain? Could be having, excuse me. No, you're uncomfortable. No, you're ticking. Thank you, Papa. I know you shouldn't be. Bluetooth up. Volume up for alarms. Let's get this connected so we can see what's happening here. Very ticky. Got the Semi 3 seizure camera monitoring. Pulse rate's 54, heart rate 67, right? Looks like Dyan's out from syncope, 11:13. That's the heart rate just dropping down, 49. So just getting the blood pressure up to see where things are at. Okay, that doesn't help me taking your blood pressure when you're ticking, sweet pea. Seizure, 11:13. Lay it right here, my darling. Sorry. No, Papa girl. No, I'm just checking your blood pressure. It's okay. It's okay. You've got seizures going on. You've got dystonia going on. I'm just taking your blood pressure. Just sit still for me, please. Oh, no, you don't. You're in a lot of discomfort, a lot of pain. Just bear with, Papa. Bear with. Spikes in heart rate. It's currently at 70. Okay. I'm getting severe, significant dystonia in the left hand. Severe dystonia in the foot distortion in the left. Right foot with full midline inversion. Okay, boo. We're getting generalized dystonia, which is the chorea. 119 over 59. That's very high for Dyan. Baseline should be 80 over 65. Heart rate is 57. What's that? Oxygen stats are good at 97. Just coming in your ears reading. Yeah, it is, isn't it? Okay, 37.4 is the temperature. Temperature in the room should be okay. 25.1, Papa. You're a beautiful girl. Slow it all down. Yeah, you are. You are. You are. You are. You are. It's okay. It's okay. It's okay. It's okay. It's okay. Relax. Relax. Just relax. It's okay, puppy girl. It's okay. It's okay. Deep pressure. Deep pressure. Come on, I need that on. Some code. 11:17. Sorry, 11:16. Oh, get him. It's okay. It's okay. Okay. It's okay. It's okay. It's okay. It's okay. Just protecting her head at the moment. It's okay. It's okay. It's okay, Papa. It's alright. Take some deep breaths. Deep breaths. Dyan's had all her normal night and day routine medications. No change there. That's no girl. Syncope 11:17. Dystonic reactions in the left hand has been subdued. Left foot is in turn but relaxed. Heart rate's dropped down to 51 again. Segmented cranial dystonia, we're getting blepharism. Heart rate dropping down 49, 48. Alright. Or a mandibular. Oh, beautiful. Right here. So oral mandibular is the jaw. The blepharism involves the eyebrows, eyelids. Haven't seen any jaw or tongue thrusting to the left that she's sometimes been doing. Getting some more upper body ticks. Heart rate alarm's just going off at 50. She's likely to go into a seizure. Hey, beautiful. You warm enough? Oh, gorgeous. Hey, it's okay.
Oh.
What's that?
Oh.
Is your arm out, is it? Okay, and both arms. Okay, both arms. Let me gently massage for you.
Richard.
No, you are my most beautiful, valuable girl.
Richard.
Beautiful. You're beautiful. It's okay. So well. This sucks. This condition sucks. So brave. My little warrior. Jaw thrusting coming through the lower left mandible. Right eyelid is totally closed at the moment. You can see the imbalance through the blepharism coming through. I am going to help you. It's okay. It's okay. You're under stress. A lot of stress.
Oh my God.
Okay, then you won't then. Okay, Dyan's meant to be going to see the vascular surgeon tomorrow. It's more a point to really see the vascular nurse to get changes in the compression stockings for full body edema. They can't do much because they need cardiology to do their thing. It's okay. Don't stress. Meant to be dealing with a pain management clinic in the afternoon for 2.5 hours. But that's a telehealth, more of a clinic introduction, which I'll have to be doing because she can't manage to do 2.5 hours for the clinic. They're not going to be, that's why I'm doing it. It's okay. They're not doing it, I am. Okay? I've got you. I've got you. Oxygen stats remain good, 97, heart rate's 57. Room temperature is 24.4. Every day, every night. How are you feeling? Itchy? Okay. Okay, I get that. Dyan has not been eating at all today. She's had hardly any food whatsoever. Her bowels have really been struggling over about a 5-day course now with gastroparesis. Her food intake has significantly reduced, as has her fluid intake. She's had so much nausea for days. So it's struggling. I'd suggest that she's probably lost a couple of kilos in weight because of the exercise. And of course, when you're not getting enough food, and I can't also give her much in the pain relief medication side of things. We're going in and out with more of the blepharocism still, and at the moment with the tilt, so you've got an axial dystonia of the neck, cranial, cervical related areas. This is happening. Nice and relaxed, good girl. She's in so much pain. Toes are good. Just getting these alerts on the device, which is just indicating that her heart rate just keeps dropping down lower and lower. Yeah, I can hear you. I know that's happening. I'm right here. You can see that the right eye is fully closed, left eye is open by about almost 3/4 of a centimetre. That's okay, it'll release soon. This is just the muscles that are in your face, okay? You can't control the muscles because it's neurologically happening, it's coming out of the basal ganglia. The messaging is coming down, it's confusing your face and your facial muscles. And there's a miscommunication that's firing off fibrillations, little twitches of the muscles, as well as fixing the positions. That's okay, they'll open up soon, okay? I promise you, you'll be able to open up your eyes soon. Pain indications on the right hand side temporalis. Okay, might be your transmandibular joint. Hello, beautiful. You just relax. You have been doing way too much today. It's been a stress day. All day has been a stress day, and it's been horrible. Horrible. I'm so sorry. No one should have to deal with all this.
I can't manage.
No, you can't. Okay?
Sick.
You can't. You're very sick, and every time this sort of shit happens, it's okay. You're doing your best.
I'm trying so hard.
Oh, I know you are.
Good enough.
Well, it's good enough for me. You don't have to do this shit. Okay? Seriously. Oxygen stats remain good at 97, heart rate's at 55, it's flapping around a bit at the moment. Can't release the dystonia. The Valium 5 milligrams that's been applied should help as muscle relaxant. Getting some jaw thrusting as the lower mandible. Still getting some twitching across. I'm not getting full tonic-clonic seizures at this stage, which is good. Maybe some difficulties with the swallowing dysphagia. Hello, baby. Hello. What's the pain? Tell me about the pain so I can try and help you.
I'm like having a stab through my temple.
Okay, so that's not a good pain to have at all. Now, obviously, with everything that's going on, there's a lot of things. There's neuralgic pain that's happening, obviously still because of the left-hand side of her face coming out of the shingles, the zoster herpes, which is the re-engagement or re-intervention. Good girl. Okay, I've got you. I'm holding your hands.
I'm so frustrated.
That's okay. Do you want me to put some deep pressure on you?
Oh, my hand's down.
It's okay. I've got them. Okay.
Please hold them down.
I'm going to hold them gently, but I'm not going to let you hurt yourself. It's okay.
Have my head laid up.
It's okay. I've got you. You know I'm not going to let you hurt yourself. It's okay. It's okay. It's alright. We've got to be so careful of everything from avulsions to contusion and bruising to dislocation and subluxations. It's alright. Trying to just regulate. Now, listen to my breathing. See if you can hear me breathe. See if you can match my breathing. Slow down. Slow down. You're so beautiful, darling. You're doing so well.
I'm not.
Yeah, you are.
I'm not coping anymore.
It's okay. It's
I'm
good.
not coping anymore.
You don't have to. You don't have to be perfect.
And
Then we're going to help you find it, and we're going to regain it again together. That's okay. Sometimes, then I'm going to be here to help you. I'm going to keep you safe. You don't have to be good all the time, okay? You don't have to be a champion all the time. Some days can be hard days, and then we improve it. But I'm here to protect you, keep an eye on you. There's pain I'm worried about with the neck. Can you say you get a pension for me? Can you swallow? I need to get some medicine to you.
This one here.
No, I've taken it away.
Oh, I don't want medicine.
I need you to have one, sweetie.
Why?
Because you actually are in a lot of pain. And I know you find it with it. No, you've also come more than that, darling. Okay. I know you can't differentiate at the moment. I'm just going to put this here under your tongue. No, I'm not, because you're not really with it at the moment. Dyan. Okay, I'm not doing it yet until I can see that you're with it enough to be able to swallow. We're not going to have a problem with aspiration. That's my finger, that's the medication. Heart rate's at 50, oxygen stats are at 97. Heart rate is dropping down, 48. Oxygen stats are dropping down. So hard to get the balance of being able to find a window where I can actually give medications. We don't have the luxury or the ability to be able to give either intramuscular or intravenous medications. Obviously I need a medical team to be able to do that. Don't have that, so I'm reliant upon oral medications, either liquid ideally, but some things I can't give. Do you have any nausea, sweetie? I can give you some Downs. I'm trying if you feel sick. Hey darling, you're doing so well, Papa girl. A true little warrior. You have been ruminating and stressing all day with so many things to deal with. It's currently 11:29 p.m. Sorry people about the camera angle, I'm trying my best to sort of keep an eye on her. Getting some mild subdued seizures, tonic-clonic in action with the arches. Still getting dystonic action, particularly cranial segmented dystonia. The position are bilaterally equal, no tension seen. Nothing through either hips or knees. Hey darling. Well, we're going to put a little blankie over you. That's your heart rate's being a silly little bugger at the moment. Now that you're back with me, we're going to try and give you some medication to help relax you. Okay, so here's the deal. I'm going to place it in your mouth and you're going to swallow for me. Yawns are good, indications of relaxation, 11:30 p.m. You know, pops. Good girl. Get it in. That's it. Here we go. Drink it down. Nice swallow. Come on. Good girl. I know that's not easy. Good girl. Really good girl. Gabapentin, 300 milligrams, 11:31. Okay, okay, I've got you. I've got you. Okay. Dystonia pain coming through, focalized dystonia in the left hand, just causing tendon flexion of the wrist, just giving a bit of traction. Does that feel okay? Good girl. Is your chest okay? Alright.
It's breathing.
Heart rate's up, 69 at the moment, oxygen stats at 97.
Breathing hard.
It is beating hard, I can see, but it's just elevated up. Just want to take your blood pressure. Do you have any chest pain? No. I've got you around. It's okay. You're doing so very well.
It's cold in here.
Well, actually, it's 24.7 degrees. It actually feels a little bit warm to me.
Freezing.
All right. Now you just lie down, relax, no chatty. Just going to feel a bit of a squeeze. What have I lost connection of data? That's the go. The dystonia is playing silly buggers with my pulse oximetry. Can't be moving around like that. Heart rate drops. 48. Oh, is it a good thing we're seeing vascular surgeon tomorrow? So we've got a 97 over 61, heart rate is 49. The previous reading that we had before was 119 over 59. So we can see the drop that's actually occurred in that space of time. Let's have a look at your itch. It's okay. It's okay. I'm just going to help keep the skin itched, but without doing any damage. With the very fragile skin that you've got, with elastomas. You're not having days like today again. You're going to relax. Okay, we've got too many things coming on. It's very stressful for you.
Everyone's confusing my wrist.
Okay, alright, I've got you down. Okay. Just supporting the left elbow brace whilst we're also doing traction coming through the left wrist. Fortunately, the dystonia is coming in and out a little bit. Do you have any other pain in the rest of your body, sweetie? Can you tell me where particularly? What feels sore?
My legs, my head.
Your legs and your head. No, when you're talking about your legs, are both legs the same or one leg different? Both legs. Is it low down or is it up high?
Hips down.
Hips down, okay. All right. Alright, the yawns are okay. You can yawn all you want. Just try and sleep if you're able to, okay?
Oh, I'm safe.
No, I'm going to be watching you. That's when you're going to be safe. Roll over. Come on. It's okay. You just roll until you're comfortable.
I'm in so much pain.
The medication I'm giving is going to help you.
What if
then I will help you. It's okay. We'll get you to the toilet if we need to. I get that. Let's give you some blankets to work with, eh? Here we go. Current time's 11:35. It's 24.8. Temperature's slowly going up here. Oxygen starts at 97, heart rate's 57. Still seeing a lot of leg thrashing activity. Hasn't been a good day for Dyan. Dyan has been really going through acute lot of stress, a lot of mini meltdowns, neurological meltdown activity throughout the course of the day. Really struggling just to be able to calm, get off that wheel of the rumination, being able to let her thoughts quieten and being able to refocus. She hasn't been able to do that, hasn't been able to relax at all. So pain has certainly been very prevalent.
Very stretch, please.
Okay, let's get your wrist. I'll be able to hear the alarms if they go off for any levels. A lot of wrist pain, aren't we?
Yeah, it's intense.
It is intense. Yeah. I still see some significant cranial dystonia going on in Dyan's face. Heart rate drops are happening as well. Meant to be at the hospital at 9 AM in the morning for vascular. At 4 to 6:30 we're meant to be doing 2.5 hours with pain, the initial part of getting into the pain management process. So it's a 2.5 hour introduction, then there's 2 days of engagement with the pain management clinic before you get to see a pain management specialist. They actually cause pain just to get hold of someone to help with the pain. Does that ever make sense? Not really. Really is stupid. If you're new to the channel, Dyan's got 22q, 11.2 deletion syndrome. It's a chromosomal disorder. It's unfortunately something you're born with, but Dyan didn't find out until 48 years of age. She had all the separate diagnoses, many separate diagnoses, because with 22q, while you're missing 30 to 50 genes, you're missing also 3 million building blocks of DNA, and that affects about 180 clinical symptoms throughout her entire cellular structure of her body. So that's why Dyan's autistic. Probably about 30 to 40% of people with 22q are likely to have autism. 40 to 60% will have ADHD. 65% of them will have seizure-like conditions. Dyan has multiple seizure styles. Tonight, very mild tonic-clonic seizures. She may have had some absent seizures during the course of the day, myoclonus seizures. You also will get focal aware seizures, atonic seizures, which will come a little bit, particularly in between the passing out fainting. You will sometimes experience that. She has cardiac related issues, so we're waiting to see cardiology. She has respiratory issues, so we're waiting to see respiratory. She's under about 23 different specialists, all because of her complex condition. She is scheduled for gastroenterology to do a endoscopy, colonoscopy. Had a good conversation with the anaesthetist the other day around these things. It's very concerning when you're trying to go under general anaesthetic. You have dystonic actions when you've got tubes and things going down your throat, when you're doing facial, mandible, affecting the jaw, jaw thrusting, heart rate flapping around, bradycardic. It's not easy. Oxygen stats are 96, heart rate's at 48 at the moment. I'm just flapping, that's why the alarm's going off. I can see it visually on the screen on the device dial, plus obviously it's recording it on the iPad, so we get the data for the clinical team. Point of tomorrow's appointment in the morning is actually to look at the edema. That's another thing that's affecting Dyan. She's got about 3 kilos of fluid weight with the edema. The dystonia, which is a movement disorder, it actually originates around a part of the brain called the basal ganglia. It actually affects the communication, and that initially appears in the face, originates with things like the blepharism, where you get the eyebrows doing the weird movement, fibrillations, fixed positions such as the eyes, or a mandibular, which is the jaw, where you get the jaw moving, fibrillating, quivering, or the thrusting type action. The bruxism, where the teeth are grinding. That's why her jaw muscles and the jaw bone, transmandibular joint, where they actually join at the jaw, both of those are subluxed on both sides, so very sore for her. She's also running multiple infections. That's also part of the condition of 22q. We're still trying to get rid of the Klebsiella, a long-term, multi-drug resistant, biofilm protected UTI, hospital grade UTI. She's got this shingles, which is just activating a neurologic pain, because it's the nerves, that fibers that come through, so it causes a nerve-based pain. That's why the gabapentin is helping that. It's okay. Right here, you've had some seizures, you've had some dystonia, and you've had some classic meltdowns. Being autistic, Dyan also suffers from meltdowns, dysregulation, and particularly emotional dysregulation, which is dealing with distress.
Can I get something yummy to eat now?
You can have something yummy to eat. Would you like some ice cream?
Something like that, yeah.
You'll wait a little bit, because at the moment your eyes still aren't balanced for me, and I need to make sure that you can actually eat with your dysphagia. Okay, so let's just wait for you to come around a little bit. How's your pain? Pain's better. That's really good.
Still in pain.
I'm sure you are. We haven't been able to get Dyan the tramadol for the last couple of days because of the whole gastrointestinal tract related issues. So much vomiting the previous day, the nausea every day. That combination between dystonia causing movement sensations around, in particular the stomach, having the GI tract affected, and then from the bowels. You're not having much fun in the tummy, are you? No, you're not. So you're going to sit up a little bit? That's a good idea. How's your hand? Can I let go of your hand now? Is that settled down the wrist? Okay, both eyes look a little bit weird. Oh, my back's stuffed. Tomorrow, I need to try and get myself off to an emergency dentist as well. I've got a cracked tooth. It's actually just cracked in half, probably also from me clenching down with all the stress and all that sort of thing. Lucky I'm not in too much pain, but I obviously need to go and get that tooth extracted because it's cracked literally all the way down. Half of it has now been removed, so it will scrape and be very sharp. You don't need to apologise, nothing for you to deal with, but I do need to try and manage him between hospital in the morning, hospital in the afternoon, managing the condition. We have no supports tomorrow because we have limited supports while we're waiting for the NDS, the National Disability Insurance Scheme, to do a change of circumstances for Dyan. So we've submitted that a couple of months ago. Time flies when you're having fun, doesn't it? So we're waiting to try and get hold of some additional funding to get some additional hours of support. Dyan has been fully assessed with a functional capacity assessment from the OT, clinical nurse, her medical team, and coming out of the hospital actually initiated the change of circumstances after 6 days being in hospital, having multiple daily seizures, dystonia, Tourette's, all events that have been picked up under the EEG while she was there at the hospital. But being so complex with 22q, they are not able to actually assist all these areas. We're trying to find a specialist for 22q, and there's not one for the adults in all of Australia. There's 2 clinics for children, one in Queensland and one at Perth Children's Hospital, but as an adult, Dyan can't go backwards. She can't access a children's specialist, even though her doctor a couple of weeks ago has actually written to the children's specialist to say, hey, please help. Not getting anywhere in the adult sphere. Can you help and guide me and give us some direction? We're trying to follow the clinical guidelines for 22q, which are the international guidelines, and trying to educate and advocate inside of the health area as well. How do you feel like for all that ice cream? Do you think you can have some now?
Yes, please go.
Ice cream time. Let's see how that goes. Alright, so we're getting an ice cream sandwich for her as I wrap up things as well. We're keeping the pulse oximetry on because unfortunately her heart rate is flapping all over the place. I'm going to have to try and travel back down to Mandurah. It's almost about an hour away to get to my original dentist to see if I can get in tomorrow morning. So that's my goal, also to work out and find out. I'm going to help Dyan with the eating, get some calories into her, because like I said, she has not eaten much today. She's a brave girl. Give her a big thumbs up of encouragement. She's a real trooper, to be honest, bearing all that she does to go through this. Remember, any of the information that you've seen tonight is specifically related to Dyan. Okay, we do this for entertainment and educational purposes. We're not here to diagnose. That's what your own primary care physician or specialist is there to do for you. So please get and seek guidance if you have issues with any of the sort of conditions that we talk about. We're here to educate and advocate for 22Q. I saw that tick, Bubba. That wasn't much fun. If you have comments, questions, ideas and suggestions, leave them below. If you're new to the channel, don't forget to subscribe, hit that notification bell. Please share our channel so that people can see what Dyan, a person with multiple complex, chronic, long-term, genetic and rare, there's about 5 different rare conditions that Dyan's dealing with. Ain't much fun. I'm going to help with her ice cream now.